talking about one of my patients. I am a physician in Brazil. Don't have my license in North America, but I work 14 years as a missionary doctor for the church there in a hospital in São Paulo, Brazil. I had a patient one time, was a girl about 10 years old, and she came to me because she has a nodule on her breast, on her chest. She didn't have breast. And then, as I was a doctor, I was able to do small surgeries, not a surgeon. And then she came with her mother, and then they asked if I could kind of take out this nodule that they thought it was a cyst. So when I examined the nodule, it was very hard and was not moving, and there was some roots inside. And then I told the mother, hey, this is not for me. I cannot do that. I will refer to my friend who is a surgeon, and he will follow up what is that need to be done. So I sent the family and the girl to the doctor. Then the doctor did the surgery and then figured out it was a lymphoma. And then he did all of the surgery, and surgeons are very fast. So he finished, and he didn't explain what to do after that. So after 1 week, the lady came back to my office, and then she said, "Doctor, I did the surgery with the surgeon, and now I don't know what to do. What do you recommend? I think we need to have a diet." He didn't mention about anything about diet, and so what do you recommend? And then of course, I am vegetarian, and I recommended a detox diet for 1 week. She was on fruits and vegetables and papaya, and then that was the thing that I was doing. And then I recommend a vegan diet after that. That's what I recommend. And you hold with me. At the end of this lecture, I will explain why I recommend those things. And then she left. She said, I can do that, no problem. And my daughter is used to do that, no problem. And then I recommend no junk food, no sugar, no meats, and so all of this junk that is around for kids, unfortunately, I recommend to not put in her diet. And in the past 2 months, she went back to the surgeon. And the surgeon asked her, "How are you doing?" And then she said, "Well, she's doing okay." And how is the treatment done? And then she said, "Treatment? Yeah. What is she doing? What program she's following?" And then she said, "Well, we are following Dr. Dos Santos' program." And then he became upset. He said, "Dr. Dos Santos, you should have been to the oncologist and follow the procedures for this disease. This is not a joke. You cannot eat papaya and drink teas to cure this disease. Come on." And then he became very upset, and he sent her to the São Paulo Cancer Center, one of the biggest centers in South America. So she went there. She identified herself, showed the case. The oncologist came to the place, and then the oncologist got all of the papers from the surgeon, all the biopsies, all the pathology, and then he asked her, "What program are you doing?" But he was thinking about what chemotherapy program she was doing. And then she said, "I'm following Dr. Dos Santos' program." Well, this lady wanna put me in jail for that. But I told her, she told the doctor, "Well, we are following this and this," and said, "Well, I am interested to see if you are doing chemotherapy, radiotherapy, whatever." And then she said, "No, this is the first time that I came to an oncologist." Well, the doctor went back to the diagnosis read the papers over and over, and then turned to the lady and said, listen, this is a very complicated cancer. Our treatment for that is not going to help. So if you are doing whatever you are doing, just continue that. Because we don't have better thing to do, and usually this case go very, very, very sour, and there is no hopes. She said, okay, she came back to talk to me, and she said, well, I need to follow with you because they don't have anything. And then I said, well, we just continue with that. And this was, after 15 years, she never had anything. So, I don't know, I like to tell this story, okay, because it's very impressive. But I tell you that I dealt with a bunch of other cases that didn't go well as this one. It looks like when a cancer can have a surgery and is not spread up, is local, and a person change their lifestyle, it looks like there is a hope for that. And that's what I'm going to talk about today. But the best treatment for cancer is called early screening. That means you diagnose the cancer early enough, and then you change your lifestyle or do the treatment. I believe surgery is one thing that we indicate for that. That is my favorite procedure, outside of the lifestyle that we are going to talk about. But people say, okay, but when a person do a surgery, the cancer is spread up. Have you heard? How many of you have heard about that? Yeah, completely wrong. Because cancer does not spread up in one day. For you to know, cancer takes 10 years to develop, at least 10 years, for a cancer to become a tumor. For a tumor to spread, it takes 2 or 3 more years, depending on the types of cancer. Some cancers are fast. But a medical procedure like a surgery will not cause this spread. It is spread because it was already spreading. So the time that the person did the surgery was too late. So, and for most of the cases, it's not what is happening. But let's go to the lecture. I will try to do the lecture. I promise that you will have access to the slides, so we don't need to copy anything. At least I asked Debbie to make it available for you, and I will give the copies, no problem on that. And then at the end, we will have time for questions, and then we will interact a little more with you. Okay. Before I go, as Pastor Jorel asked me to share a little more about myself, I think he was okay. He mentioned everything, but I am a professor in preventive care. Preventive care is a doctoral program in Loma Linda that deals with lifestyle. So we train students at a higher level. They have to do a dissertation for lifestyle-related diseases. That's what I'm talking about. That's what I mentioned yesterday, that we are focused on disease, because our program is focusing on diseases. And the reason that preventive care is focusing on diseases is that we have also a doctorate in health promotion. But health promotion is so broad that for the last 40 years, we have doctors in health promotion in the whole United States and in the whole world, and it seems that the diseases haven't decreased as much. Okay, it's not just the program. It's not just the profession that will solve the problems. The problems with diseases that we have today, that they are broad. They are caused by multiple factors that sometimes is not just one guy in the office that is going to solve that one. But in any case, we believe that health promotion should be focused on the specific diseases that are identifiable as diseases related to lifestyle. And what are those diseases? What are those diseases? Let's see if you know. Diabetes, hypertension, heart disease, obesity, cancer, anything else? I think you cover most of the basics. Stress would be something that we consider lifestyle related. Depression is also related to lifestyle, so should be an addition. Anxiety somehow is related to lifestyle too. So you know what we are talking about. So we believe that we should identify those diseases and the factors that are related, and the factors are in general common to most of these diseases. We call metabolic factors, and then we go from there. So that's how we go in the preventive care department. The preventive care program has 50 years. We complete 50 years in the fall of 2022. And it started in 1972 by Dr. Mervyn Harding in Loma Linda. 6 years after he founded the School of Public Health, he was the same founder. Well, too much for introduction, but just for you to understand where I am coming from. So we are. One time I went to 3ABN, and I told the interviewer, the pastor that interviewed me there, that we are the guardians of lifestyle. And he looked at me, what do you mean by that? Well, the guardians, the people that are protecting and keeping our traditions, okay? Keeping the Seventh-day Adventist traditions. That's why we are there. Is this a good job? It is. Is this free of trouble? No. You can imagine one time I have a trouble with coffee. I don't believe in coffee. I don't believe that we should drink coffee. And there is a pastor that believes so. And then you can imagine that. But we can talk about those things later. But in terms of cancer, this is the Bible of cancer. This book is available for anybody that wants, from the World Health Organization or the American ACRI, American Cancer Research Institute. That you can, I believe in Canada, you might be able to get it free. In the United States, it costs $50. But this book has diet, nutrition, physical activity, and cancer, a global perspective. They got thousands of researchers around the world, and then they examine the words, the studies, the papers, the research about cancer. And then they finalize and say, okay, this is something that we believe is important for the prevention. So that's why I consider this the Bible, because this was very well researched and very well scientific based. So I have a little more nutrition. In fact, it's American Institute for Cancer Research, AICR. And then we have other sources of information there. In the world, we have 19 million cases of cancer in 2020. So are you concerned about COVID-19? Yeah, we should not be that much concerned. But if you talk about cancer, by the way, I chose this lecture because cancer is the main cause of death in Canada. I'm going to show you this slide. And most of you know about that. But can you imagine almost 20 million people dying every year? It's not one time 20 million died. It's every single year we have, boom, 20 million people die. And people say, well, that's genetic, or that's fate, or that's because of the world, and then we cross our arms and don't do anything, And that's what I believe we need to do, focus on the diseases and evaluate and analyze and apply the cases, the factors that produce these cases of cancer. Because it might be happening inside of our church and should not be there. And that's the point. In 2040, they estimate that this is going to 24 million. It's the second leading cause of the world with 9 million deaths in 2020. Most common is breast cancer and the large increase in transitional countries. So here is the deaths. Lung cancer is still the most deadly one. Fortunately, lung cancer is on down, at least in Canada and the United States. Why is that? Less smoking. People are smoking less, and so that's a good thing. Unfortunately, when I mention transitional countries, are those countries that are making the transition between agricultural style and industrial style. As soon as they change this, the diseases changed. And then they have more cancer, more heart disease, more diabetes, and more hypertension and so. So the lifestyle diseases are, we could call industrialized disease. And it looks like when we enter in the computer era, after industrialization, things got even worse for these countries. And the worst thing is that many of these countries complete this transition, but they are not done yet with the infectious diseases. So they have a double burden. They have still malaria, still cholera, still diseases that are infectious, caused by infectious agents, and then they have the cancer, they have the chronic diseases. In Canada, 2 of 5 Canadians will be diagnosed with cancer in their lifetime. 200,000 new cases every year, at least in 2021. The most common is lung, breast, colorectal, and prostate. Lung, breast, colorectal, and prostate. Also, those are the same cancers that are more common in the United States. And the most common cause of cancer death is lung, colorectal, and pancreas. So I'm going to focus on those cancers mostly because those are the main cause of death. So they are the most aggressive. Also, I am going to focus on cancers that we know the causes, or we know better the factors. So you might ask, well, how about cancer of the ligaments and tendons in the back of the leg? Well, those cancers are so rare that we don't have an epidemiology to base a kind of a causal factor. So we don't know. But one thing I will tell you before I forget, and I forgot to bring the text. The only time that we have Ellen White talking about cancer is when she said that cancer is related to meat eating. And that's the only thing. And then say all of these diseases, she mentioned cancer, she mentioned tuberculosis, are related to meat eating. And I don't have the quotation here, but you can check it out on Councils on Diet, Foods and Diets and something. But that's the main reason for us to go towards a vegetarian diet. So the first answer why I prescribed that diet for that girl was because of our traditions. So we have a tradition on that we should be vegetarian because meat is not safe anymore, especially red meat. If you have to stop eating something, red meat should be the first of the list, together with sugar. And then I'm going to prove that to you later. Okay, this is a list of cancer that the American Cancer Society put. So to prevent cancer, be as lean as possible, be physically active, limit consumption of sugar. Okay, this is not Loma Linda. This is the American Cancer Society. Eat mostly a plant-based diet. What? Amen. It's not Loma Linda that's saying that. Okay. Limit intake of red meat and avoid processed meat. Come on. Do you need more evidence for that? I mean, this is the scientists in the world that are saying that. Limit alcoholic drinks. Come on. Limit consumption of salt. Meet nutritional needs through diet, not supplements. Mothers should breastfeed their children. So some things that we know since we were born, since our parents and grandparents were born. Now they are confirming those things. About 1/3 of the most common cancers could be prevented through diet, weight, and physical activity. Now we go to a list of the cases that from that Bible of cancer, the most important factors that increase the risk of cancer. So the first one in the list is obesity. Unfortunately, we are exchanging smoking to obesity. In the past, smoking was the main cause of cancer. No doubts about that. But as people are smoking less and less and less, the second culprit is excess of weight. That's, again, one more reason to fight against sugar. I was in the cafeteria today, and then if someone were there, you might see me reading the labels. And then people say, who is the weirdo there reading labels? We come here to eat, to have fun. But I am concerned about my sugar, and I'm concerned about my fiber. So food should be very low in sugar, at least those cereals and those things, or bread, and should be high in fiber. If they don't pass those, they don't go to unless an accident or an emergency, or if I'm starving and dying, I might eat those. But in general, I try to avoid. I am not that strict, but I'm trying to avoid excess of sugar in foods that don't have fiber. But here is the list of cancers that are related to obesity. Meningioma in the brain, adenocarcinoma in the esophagus, multiple myeloma, kidney, endometrium, ovary, prostate in men, thyroid. I don't know if they put prostate in men. Anyways, thyroid, breast, liver, gallbladder, upper stomach, pancreas, and colon and rectal cancer. You see that we only don't have here lung cancer. Lung cancer is not related to obesity. At least so far we cannot make that connection. But all of these cancers are related to being overweight and obesity. And obese. I have a hard time with this one. Am I too far from the... Maybe the battery is... So, from Dr. Darwin to Dr. McDonald. So I like this joke here. This is what's happening to our society. I'm going to change side here. Alcohol. During many years, people are drinking and saying that alcohol is good for the heart. That's a big lie. But some doctors still are saying that. By the way, I'm not sure if you read last week, Bill Gates did a big research, a sponsored research, and they figured out that alcohol has no benefits for people 40 years and younger. So we knew that, but now they are figuring out, and they spend a lot of money on that, and that's good. I mean, we know about that and we confirm what we knew, but there is no benefit for that. In the United States, we have a group of youth that are trying to not drink alcohol anymore. They say, why are we drinking? Not in the church. I mean, by the way, in the church, some people start drinking because they think the one cup of wine per day is good for the heart. I don't understand that, but this group of young people is saying that they feel bad when they drink. The other day they have headaches, they have they cannot work properly, their minds are irritable, they are tired, they had the hangovers. Why they are going to drink and they stop? People from outside of the church. And then let's talk about cancer. In terms of cancer, there is no benefit to drink alcohol for sure. Alcohol is a cancer agent, and this is the list. Bowel or colorectal, breast, liver, mouth, pharynx and larynx, esophagus and stomach are the risk of that. For women, is dose response. When something in science is dose response, you be careful. Dose response means you don't drink, you have the lowest rate of breast cancer. You drink 1 drink per day, you increase the risk. You drink 2 drinks per day, you increase the dose response. You drink 3 drinks, you increase the risk and increase the risk and increase the risk. So it's something that when we find this in science, we can say, hey, this is almost a causal factor. You know that science is very relative. Things that we think are true, it changes from time to time. But with alcohol, the truth is very simple. It's not good for our consumption. It's not good for cancer. This is one of my creation here, Joe Wellness. Drinking a beer, Joe, root beer, alcohol only on the outside of the body. My wife does not like my drawings. She said, come on, you can do better. I say, well, I'm not an artist, but I like the cartoon. But my granddaughter is passionate about that. She said, oh, Joe Wellness, give me one more. She has 5 years old, so you have to get some support from that age, okay? Less alcohol you drink, the lower your risk of cancer. So this is CDC. This is from CDC. It's not Loma Linda University, okay? Are you guys seeing well? Am I in the middle? I changed because of, anyways. Okay, let's go. Maybe I have to go a little faster. Huh? Processed meats. Processed meats increase the risk of colorectal cancer and stomach cancer. What are processed meat? Bacon, salami, and ham. This is something that is recent, and then this classification was put by was recognized by the World Health Organization, I believe, last year. So this is, or 1 year. I think it was right in the beginning of the pandemic, they put this classification there. Red meat increases the risk of colon cancer. And this is beef, pork, lamb, and goat. And that's the reason that I told you, if you are struggling to stop eating meat, I mean, the first one to go is red meat. I mean, there is no reason for that. Red meat increases the risk of heart disease because it's rich in saturated fat. Red meat is related to diabetes now. And for the same reason, because it releases free fatty acids, and the free fatty acids will block the effect of the receptor, the insulin receptor. I'm going to talk about diabetes in one more lecture. Foods that are high in the glycemic index increase the risk of uterus or endometrium cancer. You should be familiar with this word's womb. We are not familiar with those in the United States. This book was written in British English, so I think for you it's not a problem. What is glycemic index? Is when you eat a food and blood glucose increase in the first hour. What food caused that? Sugar. Sorry about that. Sugar and white rice, they go together. So one more reason to take white rice from our things is this. I mean, it's a high glycemic index food. So it's not good for diabetes at all. And I used to work in China. I used to work in Hong Kong. And then when I say, well, white rice is not good for you, and I have to hide myself. Otherwise, they will throw something at me. But I was working in the Hong Kong. I was touring the city. And then I went to the Hong Kong Museum of History and Art. And I entered in the museum, and I was walking around, and then I saw a small Cantonese shed. So Hong Kong is Cantonese culture. Canton is. And then I saw this hut, and I saw what they were eating, and they were eating brown rice. Because more than 100 years ago, there was no white rice in Asia. They used to eat the rice as it comes from the nature. I mean, they took the husks out and they eat the rice. And then from that time on, I will say, okay, guys, you have to go to the museum to see what rice your ancestors were eating. Because they always came with this ancestors thing. Our ancestors ate white rice for millenniums. Why should we stop now? Wrong. Your ancestors were not used to white rice, as your ancestors too. If you go back to your ancestors, you see that more than 100 years when they didn't have the, what they call the iron mill or something like that, that really polished the grains, we were used to brown rice. So let's go here, salt preserved foods. This is more related to the Cantonese foods. So they use fish, salted fish. That's one combination that is not good. Fish with salt. And I am not sure if it's just fish and salt, because most of fish and salt, they are smoked also. So you have several substances that are cancer agents with fish and salt and smoking. And wherever you smoke something, you are inhaling cancer properties. That's my problem with marijuana. People say, well, okay, marijuana is good, man. Marijuana. Now in California I think in Canada it's free also. Is that right? Yeah. So, and marijuana is free for recreation in California. And then people come to me, and in fact, my neighbor never planted any tree in his backyard. One day I was looking at the window, and they were planting a tree. And then my wife said, they are planting an orange tree. I say, wow, miracle. And then I got my binocular. Boom, marijuana. Couldn't be something else. Yeah? But and then they smoke that and say, well, it's good for decrease your pain and decrease your arthritis and decrease whatever it decreases. I say, well, how about cancer? You're smoking, you're putting those things, marijuana can cause smoking, can cause cancer as smoking cause. This is smoking, you put this in your lungs. Oh no, this is herbal. Natural. Then we have another thing that is, stomach cancer is not very common in our country, in Canada and United States. Stomach cancer is more common in Asia. Anybody knows why? Yeah. It is because of a bacteria called Helicobacter pylori. and Helicobacter pylori can cause ulcers. And Helicobacter pylori goes very well when food is left without refrigeration or without cooking. So don't leave your food in the table for 2-3 hours and then you put in the fridge. If you do so, when you do again, you cook very well, because that can cause. But the Helicobacter pylori in Asia is kind of endemic, so every food has it, and then they have a higher risk of stomach cancer. So it's not common in our society because we have fridges, we cook well. In general, we are okay with that. Similar with liver cancer that is caused by a bacteria, by a fungi called, what's the name of this? I forgot the name. Is a aflatoxin produced by this Niger, and I forgot the first name. Is a fungi. So when you don't eat nuts or something that is molded. What? Well, you might not have this experience, but I was in Thailand, and they have this fruit that gets molded, and then I don't eat when it's molded. It's like to eat a pear or an apple that is rotten. You don't eat those things. But these guys in China, in Thailand, they are used to eat whatever. And then when I don't eat that fruit that was rotten, they say, "Oh, that's good. Give it to me." And they eat all of these things, and I say, "Okay, I'm not going to go on that." But especially with nuts that are rancid, don't eat those, because they contain aflatoxin that is important that is one of the factors that can cause liver cancer. But if you eat one time, it's not going to cause anything. Okay, don't worry about it. Don't get panicked about that. It's not. Sometimes we eat a nut that was rancid and I don't like it, and so. But we are not going to die. This is constant consumption of that daily for 10 years. Okay, that will cause this thing. And this is caused because they don't have a proper way to store these grains in many countries that are developing countries. And then the food gets rancid there. Not just nuts, but corn and cereals and even fruits, dry fruits and black pepper and things like that. They get rancid and people consume that over and over and over. It's very rare, this cancer, in the United States. Well, saying that again, we have a problem in the United States with liver cancer, not related to aflatoxin, but related to, not related to alcohol, but related to, have you heard about fatty liver? Fatty liver. Fatty liver is now related to obesity. Fatty liver is related to being overweight. So when you have excess of fat in the body, this fat will be deposited in the liver and will destroy the liver. And then it might cause liver cancer. So that's another thing that we have to put in our list here. Is strong evidence of that. Okay, let's talk about positive things. Please, Dr. Dos Santos, say something good now. So that's what we are going to talk about that. Fruit decrease the risk of lung, mouth, pharynx, larynx cancers. Isn't that good? They prove that people that smoke, compared to people that smoke and eat a lot of fruits, the ones that smoke and eat a lot of fruits, they have less cancer than people that smoke and does not eat fruits. But people that eat a lot of fruits and do not smoke has much less cancer. So don't forget that. Because people take the message wrongly. Oh, so I can smoke. Thank you. Wrong. Breastfeeding decreases the cancer of the breast, and not only the breast for the mother, but the breast for the girl. So isn't that amazing? Foods that are rich in fiber, vegetable, fruit, nuts, seeds, and pulses. You know what pulses is, huh? Yeah. When I say pulses in the United States, people say, what? Pulse? Should I measure my pulse? Yeah, because I was working in Hong Kong, so I'm familiar with those terms. And again, this book was written in British, English-British. But beans. Why we should eat more beans? No, because we are human beings. But you are right. Beans are the richest source of fiber, the richest source across to the other. Thank you for that. Beans are the richest source of proteins in the vegetable. Beans, some beans have up to 20 grams of protein per percent. It reaches them almost beating meats on that. Beans have a balance of carbohydrates and protein that no other food has. So those are the ideal foods for diabetics. Beans are important for weight management. Beans are important for heart disease prevention and hypertension. I prescribe 1 cup of beans per day for my patients with diabetes. What? Yeah, and I will talk about that when we do the diet, the weight control diet. We will talk about beans and prescription. Garlic, oh my goodness. Decrease the risk of cancer of the bowel. They said that garlic is good to give to babies, because then it's easy for the mother to find the baby. Physical activity, so exercise, we decrease the risk of colon cancer, postmenopause cancer, breast cancer, endometrial cancer. And vigorous physical activity is even good for the premenopause cancer. So this is just amazing that we just need to move more and do more exercise. So I think I have to go very fast from now. Non-starch vegetables decrease the risk of oral cancer, and the main cause of oral cancer is smoking and alcohol together. So that's the main cause. The main prevention for that is to eat more vegetables, non-starch vegetables, and this is across studies that they have done a lot. So we need to eat more our salads. So summarize, enjoy more grains, vegetables, fruits, and beans. Limit red meats and processed meat. Avoid, don't drink alcohol. They said, for cancer, I'm going to read that I have here. For cancer prevention, it's best not to drink alcohol. If you do, limit alcoholic drinks and follow national guidelines. They always have to put that, but I like that phrase, for cancer prevention. Alcohol is not a good idea. And this is Joe Wellness again. But Joe, you are a vegetarian. Yes, this is to make peace with my neighbor's pit bull. Eat less salt and avoid moldy grains and cereals. For cancer prevention, don't rely on supplements. If you can, breastfeed your baby. Why they talk about supplements here? Well, many people during the COVID-19 are taking a bunch of supplements, and they think that the supplements will improve their immune system. But we don't know about that. We don't have much evidence on that. And for sure, for cancer, supplements have not been proven to be effective. So the best way is still use our foods as supplements, and not our supplements as supplements. I'm not saying that supplements are bad. I'm saying that they are supplements. When they are supplements, we should use them moderately. I even don't prescribe multiple vitamins for people to use every day because I think they are too much. So you want to use vitamins, okay, use 3 times a week, one or each other day. Because these are supplements, meaning that you have to have a main diet and something to supplement that. And that's the way, not something. Some people, they eat supplements, and sometimes they eat food. I'm not sure if you got that, but... Okay, cancer survivors should follow the same recommendations. And this is why I'm answering that question about the girl. Because she was a cancer survivor. And then and we promote what? We ask her to eat more fruits. We ask her to stop eating meats. Alcohol was not in her prescription. Smoking was not in her prescription. She was exercising and drinking water, and then she did a detox diet. What is the problem? That stay 1 week eating only fruits and vegetables. So that was good for her, and it's good for everyone. And then she recovered. Again, I mean, I have many other cases that did not recover as well. I have a few other cases that recover after a surgery. A couple of cases of colon cancer that they have the removal of the cancer from the colon, and then they change their diet, simply following what are the factors that cause cancer. And so the prescription was based on the epidemiology of the disease. If colon cancer is caused by red meat, colon cancer caused by lack of fiber, is colon cancer caused by lack of exercise, as you see. So you just put the things together and say, okay, this is what you have to do. And let's have a song here. Just to relax, I mean, would you like to stand up a little bit? Yeah, let's do it. I want you to sing with me. This is not a solo, okay? I am not a singer. I just bring this for you to wake up. Some of you are... And then, and for us to have fun and learn a little more about our lifestyle. Sing as much as you can once you learn. Today I'm gonna be a healthy person, wise. Today I'm gonna change my life, my diet and exercise. No more cancer, no more heart diseases. My fruits with my beans and veggies. I'm gonna be a healthy person, wise. I'll drink more water and have no more stress. I'm gonna change my diet and exercise. Today I'm gonna be a healthy person, wise. Today I'm gonna change Thank you, thank you. Then I learned my clicker here. Did you see my clicker? Yeah, I think I need more bell pepper. You know, bell pepper is good for memory. Yeah, you eat bell pepper and you start burping the whole day, you never forget that. Just a joke, okay? I'm going to skip those slides because I want to focus on the slides that are important for the main cancers in Canada. The lecture is going too long, and but this is the mechanism why fruits and vegetables are important. Maybe I can go faster because this quercetin inhibits the mutation of the gene P53, that is a cancer gene. Now, it looks like I cannot go on that side. Okay, quercetin foods. Green tea is rich in there. Capers are the ones that have more quercetin. But you have in lovage, that is from the parsley family. We have this in apples and red onions too. These are the capers. How many of you know capers? Yeah. The Portuguese ones should know it, because the Portuguese cuisine, they use a lot. My friend, Mr. Graça, I'm not sure, Pedro, yeah, they use that. I never eat that. I never ate that before I read this science here. But is a small thing here that they usually use as preserves, like pickles. Fruits and vegetables are rich in folic acid that protect against changes in DNA. The richest source of folic acid is found in. Yeah, we don't need to do that. When I eat beans, I got a lot of gas, Doc. And then, well, this is good to control your weight as you feel light. Whole cereals and legumes can decrease the risk of stomach and pancreas cancer, but the evidence are not very strong for that. Fruits and vegetables contain lycopene. Lycopene can decrease the risk of breast cancer and prostate cancer, and colon cancer also. Fruits and vegetables contain cruciferous. Cruciferous as a family that contain indole. Indole is a substance that is related to activate the excretion of carcinogens from the colon, from the intestine. So let's do a test here. Why cruciferous? Because the flower looks like as a cross, and cross in Latin is cruz, and that's why this is the family of cruciferous. So eating more cruciferous will help you to decrease the risk of intestinal cancer. So which flower is that? Which plant is that has these seeds, these flowers? Anybody? Arugula, got it right. Arugula. So second one, how about this one? Also a cruciferous. Spinach, got it right, spinach. How about this one? We are not familiar with the flowers, we know the plant. It starts with broccoli. How about this one? Cousin of broccoli, cauliflower. I said that, sorry about that. How about this one? This one is going to be hard. Collards. So all the family of the lettuce family are cruciferous. So eat more of those. So let's go to many cancers here. I'm not sure if you can take this thing from there. Lung cancer is related to smoking. I'm not going to spend time here. Maybe after smoking we have radiation and we have asbestos. But sometimes a person does not smoke but live with a smoker, and then this might increase the risk too. Colorectal cancer. Let's go to the positive factors. More fibers, cruciferous vegetables, whole grains, fruits and vegetables, low dose aspirin, exercise, healthy weight, stop smoking and drinking. So those are, colorectal cancer became the third more common cancer in the world. The first would be lung. Still lung is the first cancer, and even in Canada. The second one for female is breast. The second one for male is prostate. And the third one for male and female is colon cancer. In the United States, in Canada, and mostly around the world. In fact, the world is divided in terms of cancer. Developing countries have cancers that are caused by biological agents. And then I talk about Helicobacter pylori, so stomach cancer. I talk about liver cancer with Aspergillus niger. See, the name came to me. Bell pepper is helping. Aspergillus niger is the fungus that causes liver cancer, produces aflatoxin. And then the developing countries are also, they have more cervical, they call cervical. Well, how do you call here? Cervical? Cervical, yeah. In Hong Kong, they call cervical, and I believe in Britain, they call cervical. I don't know. But cervical cancer is related to HPV, human papilloma virus. So those are more common in developing countries, not as common in our countries. That are our cancers here are related to more to lifestyle. For instance, if you talk about smoking and alcohol that cause esophagus cancer, they call esophagus cancer in the upper part of the esophagus. So that's the type that mostly is happening in developing countries. So they kind of say that there is maybe another relationship between that and my memory is not functioning today. There is another virus that I think is HBV. No, the name will come. But anyways, I didn't prepare for that. But our esophagus cancer is related to the lower part of the esophagus, and mostly related to obesity, because once you have a big belly, there is a pressure from the abdominal liquids to go up to the esophagus and cause esophagitis, chronic esophagitis. And this is a precursor of esophagus cancer in the Western countries. Anyways, colorectal cancer, Epstein-Barr. I told you, Epstein-Barr cancer is the one that might be related to the esophagus cancer. Prostate cancer. Let's go to the protective factors. In the Advanced Health Study, vegans have the lower risk of prostate cancer. Fruits and vegetables, less fatty foods, exercise, weight management, stop smoking, and then doing a screening. But that's a big issue nowadays. They kind of stopped doing screening for prostate cancer. I believe if you are African American, you should do the screening after 40 years, no matter what. Because African Americans have a higher risk of prostate cancer than Caucasians. So I'm talking about the male, okay? Don't take me wrong. But in any case, I still believe that many patients that I know, they only figured out they have prostate cancer because they did the PSA. So I don't know why they are kind of excluding. But they say, okay, talk to your doctor and ask your doctor if we should, at least you should do one PSA to have a baseline. Because for me, in my experience, the PSA might not say anything, but if you have a baseline and your PSA is 0.3, 0.4, and all of a sudden it goes to 4, that's where we should be a little more concerned. Prostate cancer. Breast cancer. Healthy diet, stop drinking, exercise, weight management, clinical breast examination, breastfeeding, self-examination, mammograms, and genetic markers. So I was in Bolivia 3 months ago, and a friend of mine, his wife, was diagnosed with, well, she has a breast tumor, but she didn't want to do a biopsy. And then I say, why is that? Well, because she does not believe in the treatment for that, and she is going to a center that does breast cancer treatment without chemotherapy and so. Well, very dangerous situation. I have seen patients like that simply didn't go to treatment, and they could have a surgery in the beginning and eliminate the problem, but they let it go, and when the thing was spread around the body, they could not do anything anymore. The issue of self-examination is something that I would like to discuss. I recommend that. I recommend that women should know what she has, learn that. But the researchers are saying that this does not help because women does not know anything, and they kind of create a confusion, think, well, I have a bump here, and then go to the doctor, and this might not be necessary. The problem is that our system, I don't know about Canada, but in the United States, you cannot trust the clinical breast examination, because that's what happened to my wife. And I say, okay, you go to the doctor, and the doctor will do the clinical breast examination. The doctor then does not do it. And then you ended up not searching your breast. Of course, mammograms are important, and I hope they will develop ultrasound to do that as the same level of mammogram, because ultrasound has much less risk. I think they are working on that to have. But in any case, the reason to discuss that is that do your self-examination, learn how to do that. I used to bring a small breast for people to see when they find a nodule there. And I believe it's important. Ask your doctor for breast clinical examination for the ladies, because the best treatment for breast cancer is early treatment. So if you have a small nodule and you remove and then you change your lifestyle, you might not have a problem. I think that's the last one that skin cancer. Skin cancer is another thing that is very common, especially for Caucasians. I mean, if you have the dark skin, you don't have a problem. But avoid use a sunblock, avoid burning, and use a hat. Most of the skin cancer is in the face, the ears, the lower lips, and nose. Those are the main source. So a hat would solve that problem mostly. And but avoid burning. So it's important that this idea to go to the beach and stay there this is a breast cancer prescription. Stay there in the ultraviolet, and they go to the beach at 12 o'clock and say, my goodness, I put hats, I put some blocks, and I go there and see these guys laying down. So it's a paradise for dermatologists. Dr. D told me about sun and skin cancer, but I need vitamin D. I hope my finger will get that. So I'll finish with this. Stop smoking, change your diet, more vegetable, fruits, grains, less animal foods, help control your weight, less fat, sugar, and refined carbs, exercise, avoid sitting too much. Sitting. You know what's NEAT? They call non-exercise activity thermogenesis. So is being active, is not being sitting too long. There is a doctor called James Levine from Yale University, I believe it's Yale University, that invented this, and he figured out that this is one of the main reasons that people gain weight, because they sit too much and they don't have time for moving. So it's important to not stay sitting more than 1 hour, and that's why I ask you to stand up. And the final verse here is that we don't have all the answers for cancer, but we have hope that who believe in Him should not perish, but have eternal life. So we have hope that even if things don't go well here, this is a transitory life. We hope that in eternity we will not have these troubles anymore that we have here. These crucibles, as we are studying in the Sabbath school, they are going to disappear, and that's our hope. I think that's it. I have another song. Do you want to sing one more? This is a new song. It's the first time that I'm going to sing with you. The other one, I got a melody from Brazil, and I put the writings. This one, I wrote the melody and the lyrics. I'm not sure if it's going to be good, but let's stand up again. I want a life that's full of health and joy and peace, a life without diseases and pain. I want to live for many years, but again, But I must eat a lot of fruits and veggies, do exercise and sleep all night, and have no stress and drink a lot of water, and be with good friends hiking nature. I want a life that's full of health and joy and peace, a life without diseases and pain. I want a life for many years, but again, I want a healthy life that never ceases. And I say no to alcohol and smoking. I help my neighbor, I help the poor. We make a model to others and to family, and live with the hope of eternity. Everybody, I want a life that's full of health and joy and peace, a life without diseases and pain. I wanna live for many years, but again, I want a healthy life that never ceases. I want a healthy life that never ceases. You can sit. You have a few minutes for questions. Sorry about that. So any questions? You are going to bring the phone to them. Pastor Horrell.
We have just about 10 minutes for questions, so any questions? We start at the front.
Hi, doctor. I'm from Brazil, too.
Oh, yeah?
Yeah.
Okay.
Here in Canada, we have long winters, that's right. So we say that sunlight is good for us, but here the multiple sclerosis Canadian Society says that we should take vitamin D all year long. What do you think about that? Because the latitude that we are in Canada.
For vitamin D, my advice is to check your levels. So I would advise everyone to check. I check my levels. When I check my levels, I live in California, and I checked my levels and was, 14 or something. It should be at least 20, even though there is a lot of discussion on the normal levels. But 25 is a good micrograms per liter, whatever it is, should be a good level. But my advice first, before you take vitamin D, is to check your levels. But you are right. I mean, in your latitude, vitamin D is a requirement, and there is no food that provides vitamin D. I have a discussion with my colleagues, nutritionist colleagues, saying, okay, vitamin D deficiency and diet, and say, what they're talking about. Even if you eat 1 kilo of salmon per day, you are not gonna bring enough vitamin D. It has to be either sun or supplements. Okay?
Please take notice of the announcement on the screen.
Is there an age that you can stop taking mammograms?
Stop eating what?
The mammogram, breast exam?
I think that there is, I would say you should continue doing that according to this is my opinion. You should do at least yearly or twice a year. And the reason for that is my experience was that my mother got breast cancer when she was about 82 years old. And it was the size of an orange. And it was a bad breast cancer, adenocarcinoma. And then I was in Hong Kong when she got that. And so she called me and she said, okay, I got this cancer and they want to do all sorts of treatments. And then I told her, and that's my principle, I'm going to tell you. I told her, I don't care about the treatment that they are going to do. Do whatever they want. But the diet is my prescription. And then I told her, eat more fruits, vegetables, and all the things that I mentioned here. And then she did the surgery, she did the chemotherapy, didn't lose one hair. And then they want to do tamoxifen. But tamoxifen is a very double-edged situation because it decreases the risk of breast cancer, but increases the risk of uterus cancer. And then I told her, she said, I cannot take that drug because every time I take, I vomit it, I throw up. And then I said, forget about that. And she followed the diet, and she died with 97 years old. Amen. So I believe they should do, at least twice a year. At least every 2 years.
Yes. Right. I've heard about the free radicals in the body, in the bloodstream. And they are saying that these are the main causes of the cancer. Mm-hmm. How do they come about, and how can we prevent that?
That's a very easy question for me. Free radicals are molecules that lack of electrons, and then they will be a cause of cancer, they will be a cause of inflammation, they will be a cause of heart disease and things like that when we have these molecules that come from smoking, comes from the contamination in the water, pesticides and things. The richest source of antioxidants, the ones that offer free radicals, if you check a molecule of vegetables, you see that the molecules are full of electrons on outside. So they are the givers ones. They are the ones that give electrons to neutralize those free radicals. The best way to neutralize that is use the detox diet with rich in fruits and vegetables and substance that we have in teas. Guess what? Garlic has GST. GST is the most powerful antioxidant that neutralizes free radicals. And you see this garlic being indicated for stomach cancer, I believe, I don't remember, stomach or colon cancer. So eat more of those seasonings and eat fruits and vegetables, the richest source. Well, cooked garlic will have less, but it still has a lot. Yeah, so it's not something that you... I think we have a gentleman there.
Yeah, so my question is, you spoke about the dangers of sugar. In some health books I've read, it advised to limit or avoid high sugar fruits, such as bananas. And in other health books I've read, it said that no, that the sugar is balanced with other nutrients. So I'm just wondering what your thoughts are on the high sugar fruits.
Well, I think high sugar fruits, if you have diabetes or if you have weight, you might need to be careful with that. But this is because of treatment, not because of cause. I don't believe that high sugar fruits will cause diabetes and obesity. The problem is concentration and refination or refining. So when you consider 100 calories from 100 grams of sugar and then 100 grams of banana, the sugar is mostly 100 grams of calories, or you have to multiply by 400 calories. But the 100 grams of banana comes with a lot of minerals, potassium, comes with a lot of fiber. One banana can have 2 or 3 grams of fiber. Comes with a lot of antioxidants that you don't have in that. So the metabolism with that is not going to be 400 calories as we have here. It's going to be much less, maybe 300, 200 calories less. And in a context that is mixed with all of these that will bring nutrients to you. In 100 calories of sugar, besides that, you are going to have a little bit of constipation. That is another factor for colorectal cancer because of lack of fiber. So I would say for general public, no worries about high sugar fruits. For people that have diabetes established and have a hard time to control their diabetes, then in that case, you might need to restrict a little bit. Okay? You're welcome. Go ahead.
Yes, I'm wondering about thermograms instead of a mammogram.
What's that?
Thermograms.
Yeah, well, it has been developed other ways to check but it's not yet very recognized across the board. In some countries, in some centers, they use that, but not yet as much as accurate as mammogram.
Thank you so much, Doc. We have to end now. We have another meeting coming up in the next few minutes. We will take I'll try to get that question you're asking tomorrow, please God, as we go into our next one. Okay? Thank you so much. Can we all stand as we have prayer together? Loving Father, we thank you so much for being with us this morning. We thank you for the information we received. We pray that you would help us as we look into our health so that, Lord, we can be all that you want us to be with good health. Thank you for being with Dr. Dos Santos and him sharing with us. Continue your blessings upon him and bring us back again, we pray, where we can learn more of what we can do to prevent these diseases, we ask. In Jesus' name, amen.